From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Hello, and welcome to this JAMA Author Interview podcast. I'm Dr. Kirsten Bibbins-Domingo, and I'm the editor-in-chief of JAMA and the JAMA Network. I'm speaking today with Dr. Eugene Washington, Chancellor Emeritus of Duke University and the former president and CEO of Duke University Health Systems. We're talking about a new JAMA viewpoint that he authored titled Accelerating Climate Action Through Academic Health Systems, Leadership's Call to Duty. Dr. Washington, thank you for joining me here today.
Thank you for inviting me.
A lot of us are concerned about climate change. There have been lots of calls to action. What is it about academic health systems that is particularly important with regard to the action that we should take?
Yes. Well, it's widely known that we in the healthcare sector contribute about 8.5% of carbon emissions in the U.S. Academic health systems in particular play a role in providing help across the spectrum in our communities at multiple levels, from primary care all the way up to quaternary care. That care tends to be providing more acuity care, and they're research-intensive institutions, which means relative to other healthcare delivery systems, we're estimated that we are probably emitting more carbon emissions. And our mission is promoting health and preventing disease, and we are called to first do no harm. So from the perspective of the mission, academic health systems are well-positioned and should be motivated.
So you're saying healthcare as a sector is contributing to emissions and is a large part of the problem that needs fixing. And you're saying that academic health sectors in particular, because of the scope and the type of care we provide, are probably on the excessive end of that spectrum.
Correct.
Okay, but there's more. You make a compelling case about the missions of academic health centers and how those are intertwined to make the many aspects of the missions in the academic health center focused on this particular issue.
That's correct. Beyond taking care of patients who enter our health system, we're also often anchor institutions or organizations in a community. So the community looks to us for leadership. And the adverse consequences of climate change will often disproportionately affect the very populations, particularly those in under-resourced communities that we take great pride in taking care of. And so from that vantage point, we feel that academic health systems have this additional obligation relative to driving climate action. And at the same time, integral to our mission is education. We are training the next generation of physicians and dentists and nurses and pharmacists and other health professionals. And these are the very individuals that will have to deal with the long-term consequences of our action today. So both from a vantage point of taking care of our communities, but also preparing the next generations to promote health and prevent disease, we are uniquely positioned to advance that particular aspect of our mission.
So what types of things do you think that academic health centers should be doing or are already doing and need to do more of?
It starts, in my opinion, but this is expressed in the viewpoint with my two co-authors, at the top in terms of the leadership. And baseline would be understanding where the academic health system is relative to its carbon footprint. And that baseline should include establishing some overall goals relative to reducing that carbon footprint. Some organizations have already committed to reducing the carbon emissions by 50% by 2030. A few have committed to net zero carbon emissions by 2050. But it starts with the leader at the organization leading some effort, or having some member of the executive team lead an effort that establishes where they are, lay out some goals, and then have specific steps aimed at reducing the carbon emissions. So that's a starting point.
How do you think we are when you look at the landscape? You were a leader of a very large health system. When you look at the landscape across the U.S., how are we doing? We know that we are a big contributor, academic medicine in general, are a big contributor to the problem. You're outlining some actions. Are health systems eager to take such actions? Are we seeing many doing that? Or what's your look of the landscape?
Yes. Over the last year, I've been on sabbatical, as you know, and have had an opportunity to engage multiple academic health system leadership. And no surprise, where institutions are tend to fall in one of three categories. There is a group that is already taking action. They have defined goals, they measure them, and they're reporting them annually, and they're making progress. There's a second group that's got activities underway, but they're not very well organized. But yet they have champions on the ground, and there is some support from the leadership. And then there's the third group. Just in talking to them, kind of heard about it, Gene, but I can't tell you what's going on. And there is no plan to coordinate or enhance our effort. Regrettably, that group is sizable. That's just not at this point activated, as we would say. The second group would be the next good-sized group. They're now beginning to lay the groundwork for taking action. And the first group that I mentioned to you, the ones that's out front, that's a smaller group. So to answer your question, we have a great deal of room for improvement. But I think we're trending in the right direction.
One of the points you make is we talk a lot about collective action, but really collective action across the specific sector in academic health systems, and that there would be power to collective action. I assume from learning across how other systems are doing it, as well as harnessing the power of education and those other pieces that really is the hallmark of the missions for these types of academic health systems. What type of actions are underway to actually have these systems or the leaders from these systems learn more from each other, or at least benefit from that collective aspect?
I can tell you that there are multiple organizations currently having discussions about not just how to better coordinate the activities and accelerate the diffusion of best practice across the system, but actually organizing it into what some might call a coalition, others might call a commission, but some level of engagement that brings together these academic health systems on an ongoing way in order to prioritize what the needs are, regardless of what stage you're in. Two organizations that I am most familiar with would be the AAMC, and then the other one would be the National Academy of Medicine. Both those organizations have activities underway and are pivotal to broadening the engagement in a cohesive way across the U.S.
Wonderful. So what do you think the next steps are, or what do you anticipate? What do you see on the horizon? Your viewpoint is framed as a call to action. Some might say, well, the call's a little bit late. We should have been doing this for a while. So what's the next thing to make sure that we're not just making the compelling case, but we're actually moving to action?
This is a case where better late than never, and every little bit helps. When I say every little bit helps. So we all can do our part. The next step is at each of the academic institutions, the leader should just ask the question, what are we doing? As a simple question. And what he or she is likely to find is that there are champions already in the organization that are working silently, maybe in lower levels of the organization. And so an action in that particular setting would be to support those voices and bring them forth in the organization. And so that becomes a starting point. In other organizations that are more advanced, keep doing what you're doing, but play a leadership role in helping to bring other health systems along. And so I think that is important as well. And then third, going back to the question you asked me about what's happening at the national level, We have been leaders, talking about academic health systems and the leaders of those in advancing health in so many other arenas. We cite areas in our piece. It's important that we similarly have a coordinated voice here and have a national presence in advocating for climate action.
Well, thank you, Gene. It's been a pleasure talking with you about this. I've been speaking today with Dr. Eugene Washington about his viewpoint in JAMA on a call to action for leaders of academic health systems on climate action. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. I'm Dr. Kirsten Bibbins-Domingo. I'm the editor-in-chief of JAMA and the JAMA Network. Thank you for listening.